Okay, so here today we'll look at our agenda. First, we'll do a quick overview of our new process and why it is necessary. We're going to define who is considered a legally responsible individual and take a closer look at the reasons for allowing legally responsible individuals to be hired and their role as a PDS employee. Next, we'll review CMS requirements for defining extraordinary care and how Kentucky defines it. And finally, we'll show you how to enter a legally responsible individual request. What is PDS? So PDS, or Participant Direct Services, is a service delivery model included in 5 of Kentucky's 6 home and community-based waivers: acquired brain injury acute and acquired brain injury long-term care, home and community-based, Michelle P., and supports for community living. Participant Direct Services increases participants' choice and control by allowing them to find and hire individual employees to provide non-medical, non-residential waiver services. The participant takes on the role of the employer, like a traditional agency employs direct service providers. Participant Direct Services is delivered by following a written person-centered service plan that details the services provided. The types of services, amount, frequency, and duration are based on the participant's assessed needs and abilities, preferences and choice, and access to the community and natural support. Beginning July 1st of 2024, CMS and Dell will begin using the new review process for hiring legally responsible individuals, or LRIs, as Participant Direct Services employees. We'll look closer at the full legally responsible individual definition in a minute, but legally responsible individuals generally include parents of minor children, spouses, and court-appointed guardians. When the new process takes effect, it will no longer be completed using paper forms as it will be before COVID. The new process will be completed entirely in the Medicaid waiver management application system. The Participant Direct Services case manager will assist the participant and or participant's PDS representative in answering review questions and entering the responses into MWMA. The reviews will be conducted by the Department for Aging and Independent Living, just as they were before the public health emergency. Let's jump in on who is considered a legally responsible individual. Kentucky considers the following legally responsible. For participants younger than age 18, a legally responsible individual is a parent, step-parent, adopted parent, or court-appointed guardian. For a participant age 18 and older, a legally responsible individual is a spouse or court-appointed guardian. If a participant wants to hire a PDS employee who falls into one of these categories, they must be reviewed. Kentucky used to screen for immediate family members, even if they were not legally responsible. Under the updated process, if the participant chooses to hire a family member who does not fall into one of the categories above, they do not have to be reviewed. Here's a couple of examples. An adult Participant Direct Services employee is hiring their parent. Their parent is not the participant's court-appointed guardian. Does the parent require a review? No. In this case, the parent is not considered the legally responsible individual because the participant is 18 or older and the parent is not the guardian and therefore does not have legal authority over the individual. A minor participant direct services employee hiring a grandparent. The grandparent is not the participant court-appointed guardian. And does this PDS employee require a review? No. The grandparent is not considered a legally responsible individual because they do not have the guardianship and therefore they have no legal responsibility for that child. If the grandparent were also the minor court-appointed guardian, a review would be required. Finally, a PDS hiring a sibling, the sibling is the participant's court-appointed guardian. Does that sibling require review? Yes, if that sibling, as the court-appointed guardian, is the legally responsible individual for the participant, they must undergo the review process. So here on our side, we're sharing the Centers for Medicare and Medicaid Services instructional technical guide for our 1915C waivers. This is where we receive the information and that sets the regulations and guidance that we must follow. That's DMS and DAIL, Department for Aging Independent Living, as we develop policies for the 1915C home and community-based waivers. Per CMS, allowing the legally responsible individual to be paid as the participant direct services is not a federal requirement. If a state chooses to allow the waiver participants to hire the LRIs, as Kentucky does, the state must ensure the legally responsible individual is being paid for extraordinary care. CMS does not allow us to pay LRIs for services they are legally obligated to provide. And CMS defines extraordinary care as care exceeding the range of activities that a legally responsible individual would ordinarily perform in the household or on behalf of a person without a disability or chronic illness of that same age, of which are necessary. This is necessary to assure the health and welfare of the participant and avoid institution. Historically, Kentucky used the CMS definition, which is broad and did not clearly define which situations qualify as extraordinary care. The updated review process we used is a refined definition meant to clarify the circumstances considered extraordinary care. Because the care exceeding the range of activities that a legally responsible individual would ordinarily perform in the household on behalf of a person without a disability or chronic illness varies greatly based on the individual's age. Kentucky developed two sets of extraordinary care, one for children under age 18 and younger, and one for adults 18 or older. Next, we'll take a look at that criteria for our minor participants. The participant's care situation must meet one of the criteria in category A and one of the categories in category B. For category A, one of those three are the child's care needs have reduced or eliminated the legally responsible individual's ability to maintain paid employment in the past 12 months or longer, and there is no alternative caregiver who is functionally able to provide that care. The legally responsible individual can demonstrate attempts within the first 30 days to recruit a qualified provider, traditional or PDS, but cannot secure one. Or our third one, the minor child has a communication barrier exceeding that of his or her age-matched peers that impacts his or her ability to effectively communicate needs and wishes. So for a minor participant, you have to meet at least one of those in category A. You can meet more than one, but you at least have to meet one of those. And then one of our category Bs, the child's dependency in performing activities of daily living must be directly related to his or her disability and exceeds his or her age-matched peers. Or the second one, the child demonstrates destructive or injurious behaviors exceeding that of his or her age-matched peers, and such behaviors represent a risk of serious injury, death to self or others. So again, you would have to meet at least one of those categories of B, either one or two, or if you could meet both, and then one, at least one of category A. So when you submit that review request, your case manager, you will be asked to respond to at least one of the criteria in category A and one of those criteria in category B. You are welcome to provide information for more than one of those categories, but only one of each is required. You will want to make sure you provide detailed information. For example, if you're responding to category A, criteria 2, you may include documentation of attempts to hire a qualified provider and how those have not worked out. If you are responded to category B, criteria 1, you would want to describe and discuss the child's care needs and how they differ from a child without a disability of the same age. If you have documentation supporting your request, you can have that given to your case manager to upload before submitting that request, but extra documentation is not required. So now we'll take a look at that criteria for legally responsible individuals for participants 18 or older. The participant's care needs have been reduced or eliminated the legally responsible individual's ability to maintain paid employment in the past 12 months or longer, and there's no alternative caregiver who is functionally able to provide that care. Number 2, the legally responsible individual can demonstrate attempts within the first 30 days to recruit a qualified provider, traditional or PDS, but cannot secure one. Or 3, the participant has a communication barrier exceeding his or her age-matched peers that impacts his or her ability to effectively communicate needs and wishes. And again, the adults only have to meet one of the above criteria for the legally responsible individual to be approved. You can provide that the individual may meet more than one, but at least one of those has to be met. The adult situation, again, you only have to meet one of the criteria to be approved. When responding to the criteria, you can enter information for 1, 2, or all 3, but again, be thorough and be sure to include any additional information or documents you have. And again, any of that additional documentation and you're wanting to ensure that your case manager has, the information to meet those criteria for both of, if you're applying for the child or the adult. The legally responsible review criteria, as we mentioned at the start of the webinar, the request for an LRI review will be submitted using Medicaid Waiver Management Application System, and that's what your case managers and case supervisors utilize today. And participants do not have access to MWMA. Your PDS case manager will collect these answers from you or your PDS representative and enter that information for you and the participant's behalf into MWMA. You will be asked to sign an attestation form that the case manager has correctly captured your responses and your answers. If anything is incorrect, please speak up and work with your case manager to make sure that information is corrected. After answering the review questions, there will be space for you to provide any additional information that you feel would be helpful. You have the option to provide additional documentation, but again, that's not required, in which the case manager can upload along with the request. This may include a physician's note or medical records, a behavioral support plan, documentation of attempts to hire other employees, or employment records for the legally responsible individual. Additional information and documents are not required, so it's okay if you do not have any to include. Most important, the potential legally responsible individual, participant direct services employee, must not be involved in the request process. It is up to the participant and/or the PDS representative to request and provide the information for the review process, as the participant direct services participant is the employee. So we'll go over the review requirements, as there is some variation based on the legally responsible individual's hire date. For any LRIs hired on or after July 1st of 2024, they will undergo the review process at the time of hire and before they begin work. For legally responsible individuals hired who have never been reviewed, they will undergo the review at the time of the participant's level of care pre-certification. This includes any legally responsible individual, participant direct services employee in acquired brain injury acute, acquired brain injury long-term care, or Michelle P. waiver, hired before March of 2020. The legally responsible individual, participant direct services employee hired during COVID, the public health emergency, and the participant direct services legally responsible individuals hired between May 1st of 2024 and June 30th of 2024. No review is required for LRIs who were approved under the previous process that was in place before COVID, which would be March of 2020. And again, that's going to be for those that were prior approved through Dale for the home and community-based waiver and supports for community living. And then, of course, those that do not have to go through the review process are PDS employees who are not in one of those legally responsible criteria that we described for the child and the adult. They will not have to be reviewed, those non-LRIs. Once your request has been submitted, a reviewer from Department for Aging and Independent Living, Dale, will review that request. This includes looking at all the information you provided and any additional documentation submitted to your case manager. There are 3 possible outcomes. Of course, your approval, and you and your case manager will receive a letter that the hiring process can continue. There could possibly be a lack of information, and a reviewer can request more information before making that decision. If that happens, your case manager will receive a notification and they'll work with you to obtain and submit the requested information. If denied, you will receive that denial request and you will receive it via a certified letter notifying you of that decision. In case of a denial, the participant has options. You can request a reconsideration, and your case manager submits this request, and DMS will review the reconsideration request. You can also request an appeal hearing. If you receive a denial letter, it will include the directions for requesting an appeal. You do have to send the appeal within 30 days of the date of the letter to the Cabinet for Health and Family Service for review. You can submit both a reconsideration and appeal request. A reconsideration is not required to request an appeal. Why are we implementing these updated processes for hiring legally responsible individuals? As we discussed earlier, Dale and DMS must adhere to CMS guidance and regulations to continue operating our programs and to receive federal funding, which helps pay for them. CMS requires us to put safeguards in place to ensure extraordinary care is provided and that the participant in situations where the PDS employee receive payment from Medicaid also has decision-making authority over them. Second, before COVID public health emergency, the review process varied across all 6 waivers. Since the review criteria is not population specific, all waivers should be consistent in the process. And finally, there are legally responsible individuals currently working as PDS employees who have never been reviewed. Any legally responsible individual participant direct services employee for acquired brain injury acute, acquired brain injury long-term care, or Michelle P. waiver participants must be screened, as these waivers did not have a screening process before COVID. DMS and Dell waived that review process for the home and community-based waiver and supports for community living during the public health emergency to expedite the participant direct services hiring and help participants cope with pandemic-induced staffing challenges. With the public health emergency over, these workers must be screened to continue working permanently. We know we have shared a lot of information with you today. We want to make sure that you have an opportunity to review and ask your questions. And therefore, we have also scheduled a legally responsible participant direct services employee review process question and answer session scheduled for June the 20th from 6:30 to 7:30. And the link will be provided in this deck as well. You can send questions in the meantime to the Medicaid public comment at ky.gov. And we will also send a notification once this recording is ready, along with the slides that will be shared at that time. And then here on the screen are a few additional resources. If you have PDS policy questions, also information to our 1915C waiver help desk. You can email, submit questions to the Medicaid public comments. Our links for PDS frequently asked questions will be included, as well as our participant direct services website and our Division of Long-Term Services and Supports website. That is the end of our informational session on our new legally responsible individual process. I'm going to take a moment and turn it back over to Kelly, and then see if there's anything that we need to clarify or additional or slides that we need to go back to and walk through.
So far, it looks like we're okay there. Can you all hear me okay?
Yes, Kelly.
Okay, good. I had to switch computers. Long story. We did have one question about what documentation is considered acceptable for a minor child. I think the answer to that is there's not anything specific. It's really just any documentation that would support that request. I think we talked a little bit about that on the slides. So it could really be any number of things. I know in one of the previous I'm sorry, the previous webinars, we kind of discussed, it might be a behavior support plan, it might be a physician's note, it might be some kind of employment record for the person that you're trying to hire. It just really, really depends on what of that criteria has been kind of impacted, how the participant is impacted and what the reason for which they're trying to hire the LRI. So let's see. So can we put links in the chat? Yes, I would put some links in the chat. We've got the link to for the link to the Q&A session, as well as I believe a link to the form where you can submit the links from the last slide. Yes, I can put those in the chat. We will also be emailing all of this out, the presentation, which will have the links in them, which are clickable, but also I will put those links in the email. So there'll be a couple different ways for folks to get that. Where can you locate the recording? I know that a couple of folks have asked about that. It'll be on our website, probably that DMS LTSS website or the DMS PDS website. I will, again, an email send that out where it is. I may put it actually in both places so that there's multiple places where folks can find it. So we will get that out to folks as soon as possible as well. A couple of other, I'm just trying to look at the general things that are easy to clarify. Very specific stuff we will go ahead and get into in that Q&A session. So again, that link is in the chat. If you have not registered, I highly recommend that you go ahead and register. There is a space also to ask questions, I believe, when you register, but if not, you can email those or use that link. I know there's a couple of folks that have I think there's a little bit of confusion about that. Why don't we go back to that slide of when folks, based on when they were approved or the 3 boxes there. I think that, sorry. Who has to be reviewed when? That's what I'm looking for. Yes, that one, I think
Yes.
this is a good one to kind of go back over. So again, anyone who's hired on or after July 1st, they will automatically go through, they will go through this process if they meet that LRI criteria. It is an electronic process now. So again, your case manager has access to MWMA, to that system that we use to enter these applications. You will not. So you'll have to work with them to kind of share that information and get those questions answered. So anyone who has never been reviewed. So if you were a Michelle P. PDS employee and you're an LRI, you've never gone through an approval process because they've never had one. So you would need to be reviewed. Just anything like that. Anyone who was hired under that waived process during the COVID-19 public health emergency, you will need to go through at the time of the participant's level of care recertification. And then we do have a form. Again, I don't know how much we talked about that there. Sorry, I had audio issues, so I had to kind of juggle a little bit. So if you were, if you're hired conditionally there between May 1st, 2024 and June 30th, you would need to go through the process at recertification again. And then again, if you've been approved before March 2020, then you're good. You do not need to be approved again. And of course, anybody who is a family member but is not legally responsible, so a grandparent, a sibling, someone who's not a guardian, they can just be hired, and that's that. So that slide's there. Again, we'll send these slides out so you all can take a closer look at that. I've got a few folks asking how to register for the Q&A. So again, there's a link, should be a link there. It's like a shorter link. It says waiver participant Q&A. You just click on that, fill out the form, same as you did to get into this webinar. But if you are having any issues getting registered, feel free to email us that Medicaid public comment at ky.gov email, and I will help you. I'm just kind of going through and making sure there's nothing else that's kind of general. I know there's a lot of, okay. Can we go back to, there's the one where we kind of discussed some tips about that, about the review process. I'm sorry, I'll tell you what slide it is here in just a second.
And Kelly, while you're looking for that, just to clarify one thing that somebody had said that they got reviewed or wrote a letter and stuff last year and had to get approval. We have not been doing these reviews during COVID. So this would be the first time that you would get an approval, and it's not a yearly thing.
Yes, that's a good thing to point out. That letter that was used during COVID was just a temporary approval so that we could get folks onboarded a little bit faster, kind of address some of those provider shortages that we were seeing. So,
I'm sorry, Kelly, I lost which slide I was supposed to.
it was they were asking for the one where we talk about how the PDS employee should not be involved in the hiring process. So I think it comes after this one. I was trying to look. It's slide 10. That'll help.
There we go.
Thank you all for sticking with us as we kind of stumble through this. This is what happens when you're trying to do it kind of all virtual. So that's the review criteria. Just some additional steps involved there that the request is submitted via MWMA. So again, that's if you are a participant trying to hire a legally responsible individual, that person needs to be reviewed. So that's the review that we're referencing here. And that review is conducted using, again, the Medicaid waiver management application system. That is something that you all do not have access to, but your case manager does and will help you with that. Again, provide information about one or more of that criteria, depending on if it's a child or an adult. You have the option to provide additional documentation or information. There's a box that says, is there anything else we should know? So that's a great place to put information that maybe doesn't fall in those kind of specific criteria, but that may be helpful, or to upload documents. And again, you provide those to the case manager and they will make sure that they're uploaded. And then it's just very important to point out that that potential PDS employee should not be involved in this process. So much like when you hire someone, when someone is hiring you, you don't really have an involvement in that process necessarily until they make the hire. So same thing here. This is really on the participant and or the PDS representative's part if that participant requires support to make sure that this process goes through. So I think we have some confusion over the categories, so it might be good to go over those again as well, especially I think for children.
All right.
So there's still some folks asking if this is a yearly process. The answer to that is no. It is a one-time only process. Once you are approved, you're approved. There would be no need to review you again. So no need to worry that this is something, another step you'll have to take every year. That is not the case.
Okay, so I'm reshared the slide for the minor participant. So you must, for the legally responsible individual to be reviewed and approved, the participant would meet one of the criteria in category A and then one of the criteria in category B. And again, it is possible that you meet one or more, but you at least have to meet one of those categories there in category A, and then one of those category and one of the criteria in category B. So in those one of those three in category A for the minor participant, the child's care needs have reduced or eliminated the legally responsible individual's ability to maintain paid employment in the past 12 months or longer, and there is not an alternative caregiver who is functionally able to provide that care. For the second criteria would be the legally responsible individual can demonstrate attempts within the first 30 days to recruit a qualified provider, traditional or participant direct services, but cannot secure one. And that third criteria, the minor child has a communication barrier exceeding his or her age-matched peers that impacts his or her ability to effectively communicate the needs and wishes. So one of those criteria in category A, and then category B, it would be one of these. So the child's dependency in performing activities of daily living must be directly related to his or her age disability and exceeds that of his or her age-matched peers, or the child demonstrates destructive or injurious behaviors exceeding that of his or her age-matched peers and such behaviors represent a risk of serious injury or death to self or other. And again, it would be one of those criteria in category B. So it's one criteria at least has to be met in category A, and one criteria in category B must be met for the legally responsible individual to be approved.
So I know I'm seeing some questions asking for maybe examples or just sort of, I think, go a little deeper into these categories and maybe what that looks like. I don't know if that's something we're comfortable doing now, April. You can kind of confirm that, but it might be something that we could get a little deeper into in that Q&A webinar.
Yes, we will make sure that we can go into a little bit more of those specifics to ensure that we have, some good examples to provide there during that Q&A session later this month. Also, we will ensure that our participant direct services frequently asked questions, may include like some specific situations there as well.
I'm seeing some great questions I think we'll probably get to during the FAQ, or I'm sorry, during the question and answer session, just because they might require a little more explanation. I think we just want to make sure that we get you some good and complete answers. And sometimes when we're kind of taking those questions in right at the end of a webinar, it's hard to do that. So I'm also seeing just a few folks are asking some very specific questions about their situation. I think we will try to take those back and make those kind of general for all folks and see if we can kind of cover that in a way that answers that question for more than one person. If you have something very, very, very specific, I would definitely recommend emailing us. And I will throw some emails there in the chat some email addresses that could maybe help you with that. I think, and April can kind of confirm this. I think reasonably, it's going to be hard for us to sort of look at individual situations, even during that Q&A and throughout the process. It may just be kind of one of those, you'll have to sort of be reviewed to know the answer, but we will try to kind of, I think, cover as many of those scenarios in a general way that helps to ask. I know there is one that has come up a lot that I will address. That's a power of attorney. I know a lot of folks have asked if powers of attorney have to be reviewed. I believe we have a question about that in that PDS FAQ that answers that. And the answer is no, you do not. Unless for some reason you are also like the guardian or the parent of a minor child. If that POA somehow, the POA itself does not make you legally responsible. It would be if you met some of that other criteria. So the short answer to that is no, but I believe that question in the FAQ goes into more detail. So you may want to check that out as well. I know I've had a couple folks ask if these resources and slides will be emailed. So I just want to say again, yes, I will send you an email with a link to the recording once it's up. Give me a day or two. I've got to just get it down, edit it. We like to upload them to YouTube because that's just an easier platform for folks to watch them on. And we'll get that out there, but I will send links to the FAQs, to the registration, to all of the things that we've referenced as well. And I'm going to put these emails in here for if you have a very, very, very specific situation. So I know again, a lot of people are asking about like backup guardians. We will take that one back and try to get you all an answer.
The other I will also add is we did hold a training for the agencies earlier today. So they also received the same information in addition to what those next steps for them would look like in the Medicaid waiver management application system. So they received the same information, the same training, and then also the steps that they need to complete in WMA. So that was just the additional part that was included in the provider session from this morning.
Okay.
Again, today we are very glad that you joined us for the informational session. I am going to have Kelly to leave our Zoom platform open in case you have a few additional questions that you would like to submit. And again, we will be reviewing those and working on getting those responded. If you have specific questions, please feel free to outreach to us. We will walk through them. And then also, if you have questions that you would like to have answered during that Q&A session on June the 20th at 6:30 p.m. Eastern Standard Time, we are happy to be able to go into a few more of those questions and answers during that session. Again, thank you for joining us today, and we will be working to get our information out to you as soon as possible. Thank you.